hospitals trying to recruit doctors for staff there. You're going to be looking for more doctors yourself. I know they're looking for doctors in the Brighton, Trenton area. Let's talk a bit about that, the doctor recruitment aspect of this.
Well, I'm not sure the competition is the correct word. I mean, we're funded by the Ministry of Health through the LHIN. They gave us funding for 3 doctors. They told us really to focus on those who don't have a family doctor. There are numbers that are used at roughly maybe 12,000 people within Northumberland County who do not have a family doctor. So we've just opened up and said, if you don't have a family doctor, we now have 2 docs here. We have 2 NPs. We have a lot of services. We're open for quote business, right? And people should have choice, right? And people may want to see a family doctor. So I'm not sure it's competition that may be seen that way. We're just following the mandate we've been given by the Ministry of Health. We dialogue with people and let them know. We've talked to the hospital, and hopefully we can relieve some pressure from the emergency department so that people who go to the Emerge, really, it'd be more appropriate if they come and see if they're part of our care team, or maybe another doctor, so or walk-in clinics as well, right? So that's where we're trying to do it, and we're open to dialogue and discussing about that. Yeah.
Well, I know it is a huge issue right now, and now we talked about the partners in the community, and now you have services that you're offering right now. Are those services going to be expanded, and what type of expanded services can we look forward to seeing at the larger facility?
We want to take it one step at a time. I really would like to get a good sense of what the needs are in our communities, because we have a 50-kilometer radius. We now have 1,000, say when we reach 1,000, I'd like to be able to say, what are the primary healthcare problems those 1,000 people are presenting? Can we develop programs for those that are very specific? So if we find a lot who have mental health problems, or if we find a lot who have cardio problems or whatever, let's design some programs for those. At the same time, we'll be able to hire a couple of more staff to do some more community outreach, community development work. Partners, so maybe one of our partners said, we find this is a problem addressing something in the area maybe of poverty or the determinant of health. Can you help us in that regard? So then we'll put some resources into that. So rather than come from the top down, I'd rather have us really get a good sense of what the needs are in our communities. Port Hope, Cobourg, up in the northern part of the 401, along the 401 over to Bowmanville area. What are the needs, and then how can we address them? And it takes time, it's incremental.
So it really is grassroots healthcare, isn't it?
That's right, yeah.
Now, is there a maximum number that you think you'll be able to take on it in terms of number of patients?
In my own mind, I'm looking at the number of about 3,000 patients when we're fully staffed with 3 doctors and 2 nurse practitioners. But that would depend on the constellation of healthcare problems and issues around that. And are there areas that we may not have found out? I know palliative care might be an issue, but we've already seen some patients come in who need that very specialized support. So I know our doctors are now getting some more training in that. So that will take some resources and energy, et cetera, for that, right? So that will be a niche that we may find. And something else may come up, another area that we may find. So it's incremental. It's getting feedback from our community. It's not saying, well, this is what we're going to do and come down. I'd rather work from the bottom up and then match that with our resources. And we can't do everything to everybody. And we have to acknowledge we have lots of excellent agencies who've been working here, so we just want to partner with them and not replace them. So it takes dialogue and communication and programs like this, and move forward.
Well, I want to thank you for coming on.
Thank you very much. Thank you.
I want to remind the viewers, the Port Hope Community Healthcare Center is in the Plainview Plaza. It's Pineview Plaza,
That's okay.
sorry, in Port Hope.